Good afternoon. Today we are announcing a number of additional measures to slow the spread of COVID-19. The mandatory mask order is being extended to the entire province. You will now be required to wear a mask to protect yourself and others in all indoor public places in Saskatchewan. COVID-19 is now present in every part of the province, and you should wear a mask in every part of the province. We're also reinstating the restriction on visits to long-term care facilities. Visits to all long-term care facilities and personal care homes will be suspended, with the exception of those for compassionate reasons. Private household gatherings are now restricted to no more than 5 people, and we are now strongly recommending that only members of your immediate household be allowed in your home. This includes any building located on your property, such as a garage or a shed. There are a few exceptions. Support personnel like home care aides or therapists, and service persons like housekeepers or plumbers, they are permitted into your home. But they should maintain, of course, 2 meters away. They should maintain their 2 meters of physical distance and wear a mask at all times. Single individuals should limit their contacts in their home to visitors from one other household. For example, if you have an elderly parent that is living alone, they can have visitors, but keep those visitors from one other household. For the next 4 weeks, everyone is encouraged to stay in close touch with family and friends remotely, if at all possible, using things such as Zoom and FaceTime and all of the other technology that is available. If you absolutely must get together in person with someone from outside of your household, we should make every attempt for this to occur in a public venue, such as a restaurant. Of course, following all of the existing guidelines that are present in our restaurants, such as physical distancing, mask usage, etc. Entertainment transportation, such as party buses and group limos, are no longer permitted to operate. And in the next few days, we'll be consulting with the hospitality industry, with gyms, as well as sports and recreation organizations, on steps that we can take to improve the guidelines and to make each of these venues and each of these activities safer. We will also be consulting with faith leaders about how we can continue to make our worship services safer. And you can expect further announcements in the coming days on how we are going to make these venues and these athletic opportunities safer, not only for our kids, but for everyone in our community. At this time, if you're able to work from home, you should work with your employer to make that happen. We know that this is not possible for everyone, but we are asking employers and employees to look at which positions would be able to work from home and, where possible, work together to provide the opportunity to do so. Our government will be taking another look at all of our public servants and our Crown sector employees to determine which of them can work from home, either on a full-time, a part-time, or even a rotational basis. This is to ensure that our staff are safe, while continuing to provide the vital government services to the people of the province. All of these measures will come into effect this Thursday. These measures and all of the previously announced measures will remain in effect until December the 17th, 1 month from today, 4 weeks from this Thursday. At that time, they will all be reviewed, and depending on where our case numbers are at, and Dr. Shahab will have more to add on this, these measures could be removed, they could be revised, or they could be renewed. One may ask why we are doing this. And I'm not going to go into the numbers, as I said, in great detail. Dr. Shahab will likely do that, but I will say this. Our numbers in this province are not good, and the trend is in the wrong direction. We have too many new cases, we have too many in hospital, and we have too many in intensive care. And we need to do what we can to get these numbers down. Keeping in mind that these are not just numbers. They're the furthest thing from just being numbers. Each and every one of these numbers represents a Saskatchewan person. They represent our friends and our neighbors who happen to have contracted what is a very dangerous disease. Most will recover, yes, but some are going to get sick. Some are going to end up in hospital, as we have many in there today. Some are going to die. And that's why we need to slow the spread of this virus in our communities. And that's why we're taking these steps today. This is not a lockdown. This is a slowdown, a significant 1-month slowdown.